So write down the analysis of abnormal constituents in urine that you will do the practical today itself. So that sugar is basically a commonly used term. It indicates glucose. Basically, we will be estimating glucose in urine. Urine sample will be provided, and you will do the Benedict test. See, so this is basically detection of urine sugar. Urine sugar is basically because it can give, as I have described earlier, that sugar means all reducing sugars, and glucose is one of them. So composition. That day I discussed about preparation. The same thing, you write down basically the composition of this reagent, only that part, composition. So here you see, take 25 ml of glass tube, dispense 5 ml of Benedict reagent into it. Dispense 5 ml of Benedict reagent into it. It's a recapitulation of what I said. Recall and do it correctly. Add 8 drops, because pipette, mouth pipetting I will not allow, and it will be difficult to pipette. 0.5 ml by you. That's why you add 8 drops using a dropper of urine into it and mix. As I explained about this detail, to prevent bumping, boiling water bath, now only write, allow it to cool spontaneously. Do not use water to cool it rapidly. So allow it to cool spontaneously. This part you must be careful. Wait. I mean, after you do the test, wait, do other jobs or do other tests. By the time it will be cool, and then you observe the color. In fact, you will be basically seeing the changes of color while you will be doing the test itself. So here you see orange to red. It was 1500. It is approximately 1500 milligram or more. If it is more than that amount, that cannot be actually detected. So that is, all the reagents will be saturated. So principle again, once again I am repeating. So in hot alkaline medium, glucose in urine produces enediol, which is a strong reducing agent. It reduces cupric ion of copper sulfate to cuprous ion. Cuprous hydroxide is formed, and then to cuprous acid. The color of the Benedict solution changes from blue to green, yellow, and then to brick red with the increasing concentration of glucose in urine. Basically, the solution color change depends on the amount of reducing sugar, the concentration of the glucose solution. If it is less, then it will be green. If it is slightly more than that, that will be yellow, and then orange, and to brick red. So, as you increase the concentration of the solution, or if the concentration of the glucose in the urine is in a high amount, that then brick red color will be formed. So Benedict test will be positive for, write down all these things, positive for all reducing sugars, that is all monosaccharides and disaccharides, maltose and lactose, that you will be doing today. Also it will be included in the practical. It will be negative for sucrose and polysaccharides. I have taken a small amount of rice from the kitchen and put it in a boiling water bath. You will also see that polysaccharides do not give this test positive. It's a negative test. Sucrose and lactose have been brought from the microbiology department, and these are with you. I have brought sugar from my room. That's ordinary sugar which we normally take. In addition, I have taken that molasses or gur and banana. Also, as I have prepared as a juice, including vitamin C. So remember, the two things which give negative is, one is sucrose and the other is polysaccharide. See, very specifically, if you want to say glucose, glucosuria means specifically glucose is getting excreted, but glycosuria is a very common term, just like blood sugar. We talk about blood sugar, but basically we measure blood glucose. Similarly, in all medicine books, you will see that glucosuria term is not there. It is glycosuria. So glycosuria is synonymously as glucosuria. This you must remember. So earlier though I told you for your clarification, it's a non-glucose reducing sugars. So first point is non-glucose sugars. I told Earlier also, now you write down reducing sugar so that you recall very correctly as reducing agents. All monosaccharides and disaccharides, only maltose and lactose, repeatedly I am telling, these are the two disaccharides which will give positive result, but sucrose will give negative result. Vitamin C you will see today itself. And the fruits I have brought banana, you can add anybody, if you have brought any sweet fruit, you can taste it also. So this is the part of what you see. So renal threshold, I forgot to write down entirely this part, because that day the task was basically on renalic test. So what is renal threshold? See, when the glomerular filtrate is formed, in that filtrate, most of the substances which are present in the plasma are filtered, and your essential nutrients are also reabsorbed. So there is a threshold for all the substances. There is a capacity of the glomerulus to absorb. So this threshold for say glucose, amino acid also varies, how much it can absorb. So if that capacity is exceeded, then it will not be absorbed, so it will appear in the urine. So the renal threshold of glucose is that if the blood glucose, or actually we measure in plasma, and if the plasma glucose is about 180 to 200 milligram, then the renal capacity, the capacity of the nephron to absorb that amount of glucose is exceeded. So that extra amount of glucose will appear in the urine. That means when the patient is diabetic, when the blood sugar level is high, then only it will appear in the urine. This figure you will get as blood glucose in many books. Range might be 100, some book might write 200 also as blood glucose, but we measure plasma glucose, and this specific plasma glucose term and 180 to 200 had been taken from the recent edition of Harrison's medicine book, which you will read categorically. So the reference point here is this 180 to plasma glucose. Somebody inquires categorically, sir, this has been told in the class, and it is taken from the Harrison's latest edition book. So as I told you, in healthy individuals, because there is no extra amount of glucose, the normal load, so with the normal in healthy or normal individual with normal blood glucose level, that is called normoglycemia. Normal means normoglycemia. All glucose in the glomerular filtrate is absorbed by the kidneys. Hence, no glucose is present in urine. That's why Benedict test becomes negative. If the plasma glucose is more than 180 to 200 milligram per deciliter, then glucose absorption capacity of the nephron, basically nephron or the kidney, is exceeded. This is why glucose appears in the urine. Is this part clear? That is called glycosuria. So glycosuria indicates diabetes mellitus until proved otherwise. The more the glucose in the blood, that means if the blood glucose, somebody's blood glucose is 350, his urine sugar will be 2 plus. If somebody's blood glucose, plasma glucose is 500, 600, 700, so then it will be 4 plus. So the more the glucose in the blood, that means the more the hyperglycemia, the more the glycosuria. It is proportionate. If the amount is high, of course, the high amount of glucose will appear in the urine. So that's why I told in mild or early stage of diabetes mellitus, or if the diabetes is controlled after diet medication, then it is in the mild form. So in that case, you will get urine sugar or trace, even you may not get any sugar. In the early stage, you will get diabetes at the time of detection, but once it is tightly controlled, then if it is within the normal range, less than 180, then it will not appear. If it is not controlled, this is in mild, still hyperglycemia is there, then only urine sugar will be positive. Severe or late stage or uncontrolled diabetes mellitus, urine sugar will be 4 plus. That means blood glucose is near about more than 500 milligram per deciliter. So from urine sugar, you will get a rough idea about what the blood sugar would be. So renal threshold for glucose, you write down what is renal threshold, you must be able to tell what is this thing. Okay, this threshold will be this much is for glucose, but for amino acid it might be some other parameter, some other thing. For other parameters, urea, that will be another part. But I mean, it varies. This threshold varies from parameter to parameter. This is a vitamin C tablet, and I have taken one tablet and I have dissolved it. let it get dissolved properly. By the time you do the test, this is banana. I have taken and prepared a juice, and it is here. Let it get settled. We will collect it from there. This is normal gur, molasses. This is rice freshly brought from the hostel, and it is in the solution. This lactose has been brought from the microbiology. This is original lactose, pure form. This is sucrose, as sucrose in original pure form, and that is ordinary sugar which we take. Since none of you have brought any fruit, I could not demonstrate it. Otherwise, you could have tested this fruit juice as Benedict test as a sample as if urine or something like that. So that is an unknown solution which is containing reducing sugar or not. But all these things you will do yourself after you complete this thing. Each one of you will take one parameter and do the test. I will not do the test and you demonstrate it to your batchmates. That is the today's exercise. Okay. So here I have already done 4 preparations. Now 5th preparation I will do. This is lactose. Lactose. You take a little. We have taking a little bit of lactose here. জল দাও খাবার জলটা আমার ব্যাগে আছে এইখানে দিয়ে দিই আমার কাছে আছে ভালো জলটা আছে ধরো জাস্ট অর্ডিনারি ওয়াটারে আমি ডিজলভ করছি এটা রেখে দিলাম এখানে এই দেখো তোমাদের এখানে বলে দিচ্ছি ফার্স্ট আমি ভিটামিন সিটা করেছি then we have made it banana, then this is molasses, then this is the rice, this rice is here, and this is lactose you have given, and this is sucrose, another test tube, you just give sucrose, this sucrose I am writing. So I am taking a little bit of sugar from here. And then ordinary sugar. Now close it, one after another. Close it tightly the way you have done. You have done nicely. So next batch I can show it to you. Let it get dissolved. Okay. Meanwhile, you go to that and at the end you come. So this part is over. It is up to you to practice it. You just do this thing. You have taken 5 ml. Okay, 5 ml. Then 8 drops. You take 8 drops. Then you mix it the way I told you. How you will mix? Just see. See, this is a dense solution. So you start mixing like this, so that everything get mixed. Okay. After that, you know what is the procedure. What is the procedure?
So have to heat burn it or to boil it for 2 minutes.
Boiling for 2 minutes. So this is you write down your name here with a marker pen if there is there, or you hold it with yourself. You keep it with yourself and just go on shaking. Because this test will be taken during that testing part. Okay, you proceed to the testing part then. See, I told you if you cannot prepare 5 ml at a time, then you disperse 3 ml and 2 ml, or 2 ml, 3 ml, whatever way you think, 2 to 4. But this there should not be any air bubble. তোমরা কালারটা দেখছো? চেক করো তাহলে নিচের পাটটা বয়লিং হবে না। চেক করতে থাকো একটু চেক করো। হ্যাঁ আবার করো দেখো নিচের পাটটা হয়ে গেল সবুজ হচ্ছে দেখতে পাচ্ছ মিক্সিং হচ্ছে এবারে করো দেখো স্পেকট্রামটা দেখতে পেয়েছো পুরোপুরি See, somebody has done, this is sample number A. Sample number A is big grade. Sample number 2, sample number B sample now. Sample B, sample somebody should take sample C. So there are 3 samples. There are 3 samples here. One is A, one is B, one is C. Each having different concentration. Each having different concentration. So not everybody should take from A. Somebody should take from. Okay, A. Now A big grade. Now how will you report it? How will you report it? Urine sugar as?
Sir, mine it has more than 1500.
It will be 4 plus.
It's
No,
4
don't write down 15 more than 1500. You will Benedict test 4 plus. Plus. So yes, it is 4 plus. That report interpretation will be 4 plus. Then all these questions will be asked. Don't try to say 1500. Let the examiner ask the question. Don't ever say it will come down. It will come. It will what?
স্যার বলছি আমারও তো এই ছিল ওরও এই
একই আসবে, তুমি একটু বল করে দিলে চলে আসবে, একটু বল করে দাও, একবার বল করে নিয়ে এসো এখনই। So by this time you have got the color actually.
yes sir
Okay, so you just hit a little bit, that color will be like this. You hit it with hand, definitely you can do it. তুমি হিট করে নিয়েছো না এখনই? হিট করে নিয়েছো এখনই? একটু আরেকবার হিট করে নিয়েছো, যাও। হ্যাঁ, যাও করে নিয়েছো, কালার চলে আসবে দেখো।
আমার কালার তো প্রায়
ওই তো বলছি, দ্যাটস allow it to, you are so restless. I told you allow it to heat cool spontaneously. She has done at least 5 minutes before.
yes sir হিট করে 3 মিনিট হিট করে না পড়ে যাচ্ছিল
ঠিক আছে রেখে দাও, just observe after some time. Because entire reagent has been exhausted. So whatever maximum color will be there, color will be there. So you can show it here. Both are from A sample. So if you allow it to cool, there is a difference in the color. The difference is because this is still hot and this is normally cold. This has come to the room temperature. Touch it. Feel it. আচ্ছা,
ওগুলো তো লেখা ছিল যে একটু ঠান্ডা করার পরে কথা বলবো।
কোন আবার নিচে থেকে করছো, সাইড থেকে করো, সাইড থেকে করো, এই হ্যাঁ এরকম করে করো একটুখানি, তাহলে বাম্প করবে। তুমি মুখটা সরিয়ে দাও, হ্যাঁ ওইদিকে করবে যদি। এই তো খুব সুন্দর করছো, করো চেক করতে করো, দেখো কালার চেঞ্জটা ভালো করে খুব দেখতে হবে, খুব সুন্দর দেখতে হবে, দেখো ব্যাস ব্যাস, এই দেখো দেখছো, বললাম না একটু করে সরিয়ে দেবে, একটু সেদা ও না, অলরেডি অনেক হট হয়ে গেছে, একটু রাখো কাছে, একটু মিক্স করতে দাও, এইভাবে মিক্স করো, এইবার একটু করে কাছে রাখো, তোমার অলরেডি একদম হট হয়ে বসে আছে। না যাও তোমারটা, তুমি এ স্যাম্পল নিয়েছো বি স্যাম্পল? সি তে কম পাবে, বি তে কম পাবে, বি তে কম আসবে, এই বি এর এরকম কালার আসবে না। সি দ্য ডিফারেন্স বিটুইন দ্য 3। তুমি একটু হিট করে না, Now allow it to heal continuously. See the color difference. Bas, সেদা চলে এসো, এদিকে এসো, দেখো। See there is a difference. So this is highest concentration, this is medium plus 3 plus, this will be almost 2 plus. Do you get it?
So will the color change with time?
কালার চেঞ্জ তো দেখলে না, কালার চেঞ্জটা হচ্ছে। ওদের অন্য জায়গায় এ স্যাম্পল নিয়ে তুমি দেখো যে তুমি কি স্যাম্পল নিয়েছো, সি নিয়েছো, করো, সিতে এরকম একটু কালার কম কালার আসবে। আমি ডেলিভারি ইচ্ছা করে দিয়েছি, এ বি সি করে দিয়েছি যাতে তোমরা স্পেকট্রামটা দেখতে পাবে, কারণ ইন এক্সামিনেশন দিস টাইপ ওরকম করে দিলে পুরো বাম্প করে যাবে। একটু সাইড করে করো, উপর থেকে করো, পুরো নিচে থেকে করতে, এই যখন দেখছো এরকম হচ্ছে সরিয়ে নেবে, এই সাইড থেকে করো, তাহলে ওই পুরো নিচে থেকে করলে একদম পুরো বাম্প করে মুখের দিকে যাবে, এটা অ্যাভয়েড করে দেবে। ব্যাস, দাঁড়া, কালারটা চেঞ্জ হয়েছে তো? চেঞ্জ তো হয়ে গেছে। একটু ওই এখান থেকে সরিয়ে দাও, ফ্লেমটার কাছ থেকে একটু সরিয়ে দাও, তাহলেই হবে। ফ্লেমের কাছে সরিয়ে নাড়াও, টেস্ট টিউবটা নাড়াও একটুখানি, হট সলিউশনটা মিক্সিং হোক, হয়ে দেখো কালার চেঞ্জ হচ্ছে। এ স্যাম্পলে বি গ্রেড পাবে, বি স্যাম্পলে লেস দেন বি গ্রেড পাবে, অরেঞ্জ কালারের কাছাকাছি। সি স্যাম্পলটা একটু গ্রিন আর ইয়েলো গ্রিন পাবে, কেন এ স্যাম্পলটা তো সবচেয়ে হাইয়েস্ট কনসেন্ট্রেশনে দেওয়া আছে, ঠিক আছে? ইন এক্সামিনেশন ইউ উইল গেট স্যাম্পল লাইক দিস, and based on the color then the questions will be asked. Don't jump to answer that this much amount of present, because you wait for the question. So what is the independent interpretation? So whether it is positive, it is almost 3 plus, or it is almost 2 plus, or 1 plus, or trace, or it is nil. It can be nil also. If there is no sugar,